Hi, I'm Dr. Keshishian, and welcome to our podcast series, PPE, Podcast for Psychoeducation During the COVID-19 Pandemic. As September is the National Suicide Prevention and Awareness Month, we're discussing the importance of mental health and psychological well-being, especially during the pandemic. We have done a few episodes on how the pandemic has impacted school-age children and adolescents, but haven't yet touched on young adults and how they are dealing with this new norm. Today, I'm joined by Dr. Steven Siegel, who is the chairman of the USC Department of Psychiatry and Behavioral Sciences. As chairman of the Department of Psychiatry at USC, Dr. Siegel can speak about all the resources USC has to offer individuals who may be struggling emotionally during this time, but more specifically our students and the resources offered through student health. Hi, Dr. Siegel.
Hello.
It's so nice to have you.
Thank you. Thank you for having me on here today.
Can you tell us a little bit about yourself? Tell us your journey to becoming the chairman of the department.
So I moved to USC 4 years ago after 20 years at the University of Pennsylvania in Philadelphia. During that time, I focused on the care of people with schizophrenia, as well as having a laboratory that studied the biology of schizophrenia and developed new treatments. My laboratory and colleagues used animal models studying behavior in mice and other species as a way of understanding the influence of genes, drugs, and environment on brain development and capabilities. My laboratory also invented long-term drug delivery systems that are capable of delivering antipsychotic medication for up to a year. And ultimately, all of that technology was sold by the University of Pennsylvania to pharma and is currently in phase 3 clinical trials. So I hope that we will see that option for our patients in the near future.
Wow, that's great. And how's USC?
USC has been a wonderful challenge. The department has so many areas that it touches the lives of people and has really risen to I think, achieve more than many people, including myself, could ever have dreamed. As you know, we provide all the mental health services for LAC plus USC health system, and it really is an honor to have that kind of impact on Los Angeles and its population. We've also had an amazing opportunity to embrace and take on student mental health. And over the past 3 years, since student mental health services have become part of our department, have increased the number of clinicians in that system from 35 to about 65, and have initiated an entirely new outpatient center for the care of USC students that's outside of student health, bringing us to a total of 85 faculty members, all dedicated to the care of USC students. And while doing that, have had the ability to recruit new researchers and build new services at Keck Hospital. And so all in all, the people in our department have really strived and thrived at creating new mental health services and for many populations. And it's just been an honor to be part of that effort.
Thank you for explaining that. So it seems like student health has really been transformed and reformed, especially at USC. And, we were today talking about the college experience, and that looks really different nowadays. Some colleges are only doing remote learning, some have a hybrid. Many don't have their student body on campus. And for a lot of freshmen, this is not necessarily the experience that they were thinking of at the beginning of high school. Can you talk about a little bit how this new norm has affected our college students, their learning, their personal and social growth?
I think we won't know the definitive answer to that for a long time, if ever. To my way of thinking, life is about adapting. It's about growth and learning how to figure out what's required of me now in order to succeed in these circumstances. And ultimately, coming through college is less about the acquisition of specific knowledge than it is about learning how to adapt and meet the needs of whomever you are with. And so in that sense, we might say that college it's different than they expected, but they should have access to acquiring the same skills in new ways. So I would expect this generation of college students to learn how to function in a digital world better than any former generation. I would expect that this class of freshmen will be the best equipped in all history to be able to interact with people where they are, as they are, regardless of where in the world they live. And so while they may lack the ability to go to parties or hang out in dorms together, which is a loss, they've acquired an ability or are acquiring a unique set of skills for which they will be incredibly valuable as they enter the global market and essentially the post COVID world
Mhm.
in which tele everything
Mhm.
will be a whole new horizon. So we can think of them as the lucky ones. They're the ones who've trained in the new world while the rest of us are learning how to adapt and catch up.
Well, that's very interesting. And thank you for that perspective. I think that there are a lot of times pressures that students experience in college, and that's part of that growth that you were talking about. Outside of COVID and the pandemic, can you talk about the pressures and struggles that many college students face, even in the best of times, and then how that might have changed during the pandemic?
So as I'm sure you and many of the listeners know, mental health issues and diagnoses have been steadily increasing for the last 20 years. And college students as a population exhibit mental health problems, illness, diagnoses at a rate of approximately 20%, or an incidence of about 20%. And so it's become, in some ways, the norm to experience significant mental distress during this period of life. And while there's no single factor that I think anyone could identify, I think you can look at the iterative impact of increasing competition, this sort of relentless pattern of pushing greater and greater academic demands earlier and earlier in life, really resulting in a whole different set of expectations, than had really been appropriate just a generation ago. The example I would use is just juxtaposing the impact of advanced placement or college classes in high school. A generation ago, at my age, if someone took an AP class or two, they were really, really pretty far out ahead. They were doing
Mhm.
college level work as a high school student, and that meant that they were, pretty special. Now, in many high schools across the country, if you're not taking all AP classes, starting perhaps in ninth grade, you're not competitive. And so, high school students are leaving high school with 13, 14 AP classes. They have, in many ways, started college as ninth or 10th graders. And so, moving to that level of pressure and competitiveness has just taken a toll. I think the other thing that's important is um, how people very early are feeling like they have to know what they're going to be,
Mm.
and feeling like if they can't achieve that trajectory, that somehow they're failing or that they can't recover. And I know that one of the issues we'll discuss is suicide awareness and suicide prevention. And I've always thought that people turn to suicide when they can't see another path to success or another path to happiness. It's this inability to see another path.
Mhm.
And my sense is that one of the things we could do to reduce a lot of the distress that college students are experiencing is to be very intentional about making sure people know that there is always another path. There's always a path that is just as good, maybe better, and helping them see the endless possibilities. To be cliche, as one door closes, many more open. And that kind of mindset that there's always another path can be very empowering. But I don't know that we do enough to help people see that all the time.
Yeah, I mean, thank you. It seems as if maybe reaching out for mental health resources could be part of the solution that you're talking about. I mean, that's an interesting statistic that you mentioned. 1 in 5 college students experiencing some sort of mental health condition. That's pretty significant. And there is still such a social stigma surrounding mental health. How do you think that we can empower our youth to be comfortable in seeking help?
One, it's just making sure they know how to get it and um, how, where, when. I think if there's one, I wouldn't call this necessarily a good thing, but a silver lining of sorts, is that I think there has been a normalization of mental health as part of your medical health and as part of your life. I I don't see stigma as the main barriers to care. And it's not to say that there isn't work to be done to help people understand that this is part of life, and there's nothing more um, embarrassing, so to speak, about feeling depressed than there is about having diabetes. These are things that are part of our biology. They happen, they can be addressed. On the other hand, a lot of students are seeking care. And I think the challenge for us as a community and a society is now not only to make sure that we remove biases or stigma, but that we actually provide access.
Mhm.
I think the biggest barrier to mental health care in society today is simple access. And that's why USC students have far greater access to mental health services than their parents do, than you do or I do. Once you're out of college, you're reliant on the availability of mental health providers, psychiatrists, psychologists, therapists with a variety of other degrees. But in general, your insurance does not pay nearly the cost of those services. Nobody's does. And so health systems are hard pressed to be able to afford to have providers because they lose so much money on those services. And as a result, mental health providers are forced, so to speak, out into the community where a majority of them work on a cash only basis. This is a lot of detail, but these are the real issues. The real issues are that insurance does not cover the cost of care, and most people can't get mental health care because their insurance doesn't pay for it. I think it's less about stigma than it is about access.
That's very interesting perspective that you provided. We recently did a podcast with Judge James Bianco from the Mental Health Court, and that was his exact response as well. That is lack of access. That's the problem. So it's interesting hearing it from both angles. I, I mean, let's go back to another topic that you had mentioned, which was suicide, and that's what we're talking about. September is Suicide Awareness Month, and there was an alarming statistic from Association of American Universities that reported 20% of American college students reported suicidal thoughts, and suicide rates among the young Americans are at high level. Why do you think that is?
Again, it would be hubris to act as though I had the answer. I can just comment perhaps on some of the factors, and some is what we've talked about. Right? There's a sense of just immense pressure that students feel from a very young age to be functioning at levels that vastly exceed their developmental stage. And, to feel at 14 or 15 that you're supposed to be mastering what used to be a college level class, and if you don't get an A in it, you're not going to go to a good college. Right? That's a lot of pressure. There can be a conflating of rigorous and mean, and our society has it glamorizes mean, and mean is not okay. If a student is struggling saying that, you have high standards, it's often a euphemism for you just being mean. So I think we need to make our educational systems rigorous without having them be mean. I think we need to be more realistic about the true value of asking people to do things at times and ages that they are not equipped to do. Is it really healthy to start separating people by their aptitude in physics at the age of 14 or 15 years old? And then I think we need to do a better job of true access to mental health services so that when people do begin to struggle, they can get help right away. And there needs to be a broader awareness that just because you're not excelling in this class or in this topic, that does not mean that you are not a success. It's just an opportunity for you to find the other things in life that you do excel at and find the other perhaps career path that you will thrive in. So that was a, kind of somewhat circuitous path to saying a little bit too much pressure, a little too little kindness, and a little too much rigidity when it comes to the myriad of pathways to happiness that people should feel are in their life.
Yeah, I think you touched upon lots of very important things. One of the things you had said earlier is people not seeing a different path and not being able to recognize that there are other opportunities. And sometimes it's difficult when you are in the middle of, feeling stressed out or sad or depressed to recognize it, but others might be able to see that there's a change in you. What can we do for our loved ones? What kind of signs can people look for if someone that they care about is not doing well or might be in need of help?
Well, one is to show kindness and empathy. There's nothing wrong with saying, you look like you might be struggling, but I care about you. Please let me know if there's anything I can do to help. A simple connection and expression of empathy can go a long way. People who feel cared for, just have more resilience and can move forward. It's also making sure that while respecting, their privacy, that you mention that there are resources. So it's probably not the worst thing in the world to say, you know, I don't see you smiling as much as I used to. You don't seem as happy, or you just seem down. Have you thought about going to speak with someone about that? Could I help you find the phone number? Little things like that impart both, actually, I do care, and provide a real path to help. So I think those would be the kinds of things people can do.
And can you speak about the resources that are available to our students and our community through USC?
Yes. So for students, we have student health, which is broken into the physical health side and the mental health. And mental health is called counseling and mental health services, CMH, counseling and mental health. We offer both therapy and psychiatric services there. And during that set of interactions, it can often be a very brief interaction. Sometimes people just need to talk a few times and work something out. But sometimes it's more than that, and they really need to enter into care. And for that, we've now built a practice called Psychiatry and the Behavioral Health Services, PBHS, in which we have 18 full-time clinicians, therapists, and psychiatrists who only see students. And so USC students can enter into care in that environment for whatever they need. So it's all the care that's appropriate. And we strive to help people get back on their feet and not necessarily need to be in care forever, but we offer what they need, as much as they need. Once you're out of college, there's two segments of society for which mental health care, I believe, is accessible and quite good. One is people who use the public system, the patients at LAC plus USC Hospital and all of its associated outpatient clinics. I think there's excellent care there. We can see people, we take care of people. There's highly trained doctors on the mental health services, whether that be inpatient, outpatient, or consulting to other physicians on the care of patients. It's called consultation liaison. And so for people who use the public health system, I actually think you go to your, local either Department of Mental Health clinic, DMH clinic, or you come to one of the DHS clinics, like us, Department of Health Services clinics, and we will take really good care of you. I don't know what fraction of Los Angeles is served in that system, but I'm guessing it's about between 10 and 20%. I think it's not trivial, but it's not everyone.
Yeah.
And then there's people who have unlimited resources. If you can spend a few $100s a week out of pocket on your mental health care and it will not impact your budget, you're fine. There's plenty of psychiatrists and psychologists who will work for an appropriate rate as long as you pay them up front and then you have to go get the money back yourself, so to speak. So if you have a lot of resources, you can get care. And again, not knowing, sort of hard numbers, I'm guessing in a city like Los Angeles, maybe 10% of the population can do that.
Mm-hmm.
And then there's everyone else, people who rely on their insurance in order to get their medical care, people who don't have an extra $10,000 or $15,000 a year that they can spend on a service that should be covered by their insurance, but simply isn't. And for that portion of society, that 60 or 70% in between, we have a hard time. The solution is that we need to demand that insurance reevaluate what has value.
Mm.
And this is not actually a decision that each company makes by and large. What they do is they follow the government, the Centers for Medicare and Medicaid Services. Those rates are actually set by the American Medical Association on a committee that is largely made up of the specialties who are very, very well paid. And so our entire system says the specialties and areas that are disproportionately well paid now continue to set the rates, which the government accepts without question or without auditing the true value. And they set Medicare rates, and everybody else reimburses or pays as a multiplier of Medicare. And so until people demand that the government and their insurance companies actually value their mental health more than they value a procedure, or at least as much, we will have what we have. You get what do you value. And unfortunately, we as individuals may value our mental health. We may want better access to care so that people don't spiral down a path of demoralization, depression, and anxiety until they feel so hopeless that they can't see any path forward beyond, suicide, right? If we want to change all of that, really the first place to go is go to CMS and demand that they value mental health.
Do you think that the pandemic and the effects of it, especially as this is not only a physical pandemic, but a psychological one, has made any changes in this arena?
It's increased access in some ways. So it used to be that it was very difficult to provide telehealth services. In general, there were some limits, but in telemental health in particular, it was very, very difficult to provide those services. Well, all that's changed.
Mm-hmm.
It's changed at the level that I've been addressing it. So right now, reimbursement for telehealth is the same as for in-person health. There's no financial disincentive to offer people care where they are in the most convenient way for them. But it's more than that. It means that we can offer the services people need without requiring the physical space and infrastructure investment that it used to require. And there's absolutely no reason to justify going back. We should never give this up. It works fine. It doesn't work for everyone, so we'll need some level of in-person care. But for most people, most of the time, it works, and we should keep it.
Thank you, Dr. Siegel. And I really want to thank you for all of your insight and everything that you've talked about today. I'm sure as a department chair, it has been a very difficult time for not only you and your department. I wonder, before we wrap up, if you can tell us a positive moment or a special moment that you've experienced during this time that you'd be willing to share with us.
There have been so many, so I'm glad that we're ending this way. The when we went into this period, it became very clear very quickly to everyone that healthcare workers were going to be sacrificing a lot, would be working in ways and at for times, periods of time that really were going to stretch them. And to respond to that, USC, with our department, or the health system really, so Keck Medicine, designed a system that some people have heard of called Care for the Caregiver, where we offered really robust mental health services for free to all healthcare workers and their families. And that was a special thing. But the most special thing for me was how our department, it's a very large department dispersed across many environments, as we discussed earlier, county hospital, um, Augustus Hawkins inpatient facility out at the Martin Luther King Health campus, the Keck Hospital, Norris Hospital, student health, both campuses, so widely dispersed. And to a person, everyone volunteered to be part of this effort. And it formed a cohesive, overarching purpose to volunteer and take care of the healthcare workers so they could take care of everyone else. And it gave us unity and purpose and cohesion. And that too is something that we will keep, because now we know that when we join together as a department and have a single unitary focus, we can do things that we never dreamt were possible before.
Thank you, Dr. Siegel. I really appreciate you joining us today. It's been an absolute pleasure.
Thank you for having me and for doing this. It's really a wonderful service you are providing.